Hi there and welcome to this series of videos on rooms. I hope you've enjoyed it so far. So in this particular video, I'm going to talk about optimal room layout and some considerations anyway, regardless of whether you're in a commercial space or whether you're in a converted house, how you can optimally lay out your practice and things that we've seen over the years that have worked really well for doctors. So firstly, doctors often ask me, what floor space do I need? Now, again, it's a rule of thumb and it depends on the layout of the practice to be exact. But basically for a single practitioner, you'll be okay to have space of 100 to 120 metres. Now, if disabled toilets do not need to be built within the suites, then that will be fine. If you do need to build disabled toilets within your space, then add another 20 metres. So you might be looking at 140 square metres. If you've got two practitioners, you might be looking at 150 to say 180. Add disabled toilets within the suite, then you might be looking at 200 square metres. So that will give you a guide. Now, a little bit depends on how procedural you are in the rooms because you'll need some extra rooms. For example, an ophthalmologist might need a little bit more space because they're also accommodating an orthoptist and so forth. A plastic surgeon might be also accommodating a clinical nurse. So that's a guide for you though, at roughly what you'd be looking for space-wise. Now, other considerations with optimal flow, think about how you're going to move around the room, because what you're going to want to do is maintain maximum efficiency. You don't want to be there all day or longer than you have to be, so you want to be efficient in your use of space, and that's good for the patients obviously as well. But you also want to be private as you're moving around as well. So consider how you're moving around the actual practice. Are your patients that are waiting in the waiting room going to be staring at you all the time as you're moving along? Now, it might not be possible that they're not doing this, but you can use screens and different things so that you can increase your privacy. The same with patients though. How are they going to move around? Does it make sense to them? So for example, if you were an ophthalmologist, and we've done lots of ophthalmology rooms, so I know this well, you're firstly going to go to reception and then you're going to wait to see the orthoptist. So in that particular room, you might need two waiting rooms. So the first waiting room to wait for the orthoptist, the second waiting room to wait for the ophthalmologist. So they're the considerations for that type of room. So think about, how does the patient see you? If the patient is going in and seeing you in the consulting room first, then logically it makes much better sense that your consulting rooms are near the front of the building. Then they move on to procedural rooms and so forth. Not everybody's got as much space as that they can do, a one-way sort of entry and exit. I have seen it done and we've built a few rooms that are like that, but that's a real luxury. But at least consider people's privacy. We talked about sound and things before too. Consider what rooms are next to the waiting room. So if you've got the procedural room next to the waiting room, for example, and people might be making noises and whatever, maybe it is audible to the waiting room. It's not the kind of noise people want to hear. Whereas in a consulting room, the noise is quieter and so forth. Usually it'll have some carpet in it and it'll deaden the noise. So consider those things when you think about your optimal layout as well. Also, give consideration to your receptionist, and obviously the layout of the reception desk is important as well. We're not going to go through all that today. But consider if you've got one receptionist, for example, and she has to go privately to formalise a quote or organise a hospital procedure for somebody, then how's the front desk going to be manned? Are these spaces next to each other so she can easily, or he can easily, man both spaces as well, and the security of the practice is not in jeopardy at all? So those sorts of things are really important as well when you consider your layout. In your individual room, consider safety. So you don't want your back to a patient, for example, when you're sitting at your desk and they're coming into the room. Consider the light. So you don't want your light on your computer screen, but you also need your light to sometimes feel happy in the space. So consider the angle of the desk in relation to those things, and consider also how you like to sit with your patients. So if you are, physically touching your patient and examining them before they go onto an examination bench, for example, then it might be easier that they're at right angles to you rather than across a desk where you completely have to go around and see them each time. Think about too, how you work the room. So for example, we're not talking about you know, a nightclub from the 80s here. We're talking about how you work the room in your consulting. So you get up from the desk when you've seen a patient. Do you go and wash your hands first? Then do you move over to the couch and so forth with the patient, then back to the desk? So consider that and how you'll move around the room. Does it make sense for you? Have you got the room to do it? And can you do it easily without avoiding, you know, a tripping hazard along the way or whatever? Because you're going to be doing that many, many times. So you want to make sure that that room works for you. People often say to me, what's the ideal size for a doctor's room? Well, of course, it depends on what you're doing. So if you're doing some minor procedures in there, you're going to need a little bit more room. If you're just consulting, these days 2.5 by 3 can be okay for consulting. But you know, optimal, it's your life, you only get one life. 4 by 4 is beautiful. You get plenty of space in a 4 by 4 room. You get to do all the things you want to do. I would make sure you have light filled, but yet private for the patient, so that you feel happy in the space. As I said, you're going to spend a long time there, so you want to make sure that you're happy, particularly in that space. So there's some design and optimal layout considerations for you to consider when you're either looking at rooms that are already done or you're planning out your layout and how the room should work for you. Thanks very much for watching.